So in this video we are going to talk about cervical spine special test. In my previous video we discussed more about distraction test. So in this video we are going to discuss the opposite as the compression test. So we are going to talk about 4 tests. So facet compression test is a Spurling's test. Second is a modification, is a Jackson's compression test. Third is maximal cervical compression test, and fourth is the scalene cramp test. So we'll start with the first test, that is facet compression test or a Spurling test. Now, these tests are performed to provoke the symptoms one more time. So if the patient has a history of nerve root pain or radiculopathy, and during the examination if these symptoms are diminished or absent, so this cervical spine compression test or facet compression test are performed to provoke the symptoms one more time. Now, Bradley and colleagues suggested that this test should be done in 3 stages of severity. Each stage will lead to increase in provocative symptoms. So if the symptoms are reproduced, don't proceed to the next level of severity. So the first stage. So in the first stage, compression is applied when the head is in a neutral position. When the cervical spine or a head is in a neutral position, the examiner just applies the compression to check if the symptoms or a radicular pain or shooting pain in the upper extremity is there or not. If not, move to the second stage of severity. Now, what is the second stage of severity? So second stage of severity is head is in extension, and then examiner applies the compression, just a vertical compression to reproduce the symptoms. If the symptoms are still not reproduced, go to the third stage. So some people say the third stage is a true stage where it is called as a Spurling's test or a Spurling's sign. So in this, the extension and rotation to the affected side, and then examiner applies the compression. Pain down will indicate a nerve root compression or radiculopathy. So all these tests, especially the third stage where the extension and rotation and the compression is applied straight down, first perform the unaffected side first. So if the patient has no pain on the left upper extremity, perform on left side first and then come to the right side. So unaffected side first. In this position, the intervertebral foramen will compress and so if the patient has stenosis, cervical spondylosis, inflamed facet joints, herniated disc, or even the trophic will reproduce the symptoms. Now there is one other terminology called as a ReverseSpurling'sSign. So what is ReverseSpurling'sSign? So if you perform, let's say, the Spurling's test on the right side and patient says my left side of the muscles are in a pain, so that means that a patient has a cervical strain, tension myalgia, or WADs called as a whiplash associated disorders where the muscles are pulled or cervical strain. Second test is a Jackson's compression test. So Jackson's compression test is a modification of a Spurling's test or facet compression test. In that, patient just rotate the cervical spine and examiner applies the vertical compression. Always first do the unaffected side first. So if the patient has no pain on the left side, perform the left side first and then perform the right side. If the patient has pain on the right side, do it last. So rotation on that side, right side of the cervical spine, and compression is applied. Pain radiates down into the upper extremity and her arm will lead to positive test. But if the patient has localized neck pain, doesn't mean that the test is positive. And it's same true with the facet compression test. If the patient complains a localized pain in the cervical spine, doesn't mean that the test is positive. In order to be a positive test, the pain should radiate to the upper extremity. Third compression test we'll see is a maximum cervical compression test. So in that, always perform the unaffected side first, come after the affected side. So in this, patient side flexes and rotation of the cervical spine to the affected side, and examiner then applies the compression, the vertical compression, if the pain and symptoms are reproduced. Second level or second part of the maximum cervical compression test is side flexion and rotation to the affected side, and then do the extension. Now, extension component will maximally compress or maximally closes the intervertebral foramen. This position also compresses the vertebral artery. So in order to reproduce the vertebral artery symptoms like dizziness, feeling faint, nystagmus and nausea, hold that position for 20 to 30 seconds and make sure you do it in a safe position where the patient is in a dependent position. Patient may faint, right? So fourth test will come is a scalene cramp test. Now, why we are discussing scalene cramp test? Because it is one of the compression tests, not with the compression, but examiner check whether the pain is reproduced with the facet compromised position. So patient rotates the head to the unaffected side first, and then after rotation, patient side flexes the cervical spine, or just patient flexes the cervical spine, where patient tries to put the chin in the hollow space just above the clavicle. Localized pain will reproduce. That patient has trigger points in a scalene muscle, but if the pain radiates down, that means the patient has either the flexopathy or TOS, thoracic outlet syndrome. Thank you.